Hi, I'm Dr. Chad Larson, and this is Keep It Real. Keep It Real is all about real talk based on my 20 plus years of clinical experience. What we're really talking about is real food, real medicine, and real change.
Hello, and welcome back. So today I'm going to fulfill two requests. The first request is that I bring back these rucking talks. So I'm rucking. What's rucking? Rucking is just walking or hiking with a weighted backpack. So I've got about 40 pounds in my rucksack. And then we're talking. That's the second request. I'm going to talk about a topic that somebody requested, which is a condition called SIBO, small intestinal bacterial overgrowth. It's actually a pretty common condition, and it has some interesting nuances. What is this condition called SIBO? As I'm sure, the gastrointestinal tract is lined with bacteria, with a bunch of different microbes. And most of this is supposed to take place just in the colon, the large intestine. The large intestine has a lot more microbes than the small intestine. So your gastrointestinal tract is about 30 feet long. The majority is the small intestine. It's about 22, 24 feet of small intestine, and then 4 or 5 feet of large intestine. And most of the microbes are supposed to be in the colon. The colon has a 2-cell layer thick barrier system, and it's meant to handle all the gases and fermentation and different things that happen in the colon. But for a variety of reasons, sometimes the bacteria want to expand their real estate, and they will ascend. They will move up into the small intestine where they're not supposed to be. And they're going to do what bacteria do there, which is ferment. So this is part of the important symbiotic relationship between us and our microbes, is that they get to consume certain parts of our foods that we can't really consume, like certain fibers, and they can digest these fibers and produce something called postbiotics or short chain fatty acids like butyrate, and then we get to use this substance. Our gut cells love to use butyrate and other short chain fatty acids as a fuel source, as energy. And so it's a pretty elegant symbiotic relationship. But when things go wrong, and this happens in the small intestine, then they're fermenting fibers in the small intestine, and that can cause distension and bloating, gastrointestinal discomfort, maybe diarrhea, constipation, bowel movement changes. So this could be a really uncomfortable condition. And it's likely that their primary care doctor and maybe even their gastroenterologist are not diagnosing this as that problem, and they might be being treated for almost a different problem, and it's not going to help in the long run. And there's a fairly specific treatment protocol, but before we get to that, it has to be diagnosed properly. First of all, distension, bloating, this can happen for other reasons, but it's a really common symptom of SIBO. Those particular symptoms are what make me think of SIBO and consider testing it. The classic way to test for SIBO is a breath test, because these bacteria in the small intestine they make it in the large intestine too, but they make a gas called hydrogen. Some also make methane. But hydrogen is the key one in this regard, because we're really trying to map where along the GI tract this bacteria is fermenting and creating this gas called hydrogen. And we can use breath testing as a mapping device to see where along the GI tract these things are being produced. Because if it's happening down the colon, that's fine. That's where it's supposed to happen. And that's not SIBO. But if it's being done in the small intestine, then the way that is detected with the breath testing is it's all about timing. A person consumes a fairly specific amount of this fermentable fiber, and then they start breathing into these mylar bags. This is how it's classically done. By the way, I do it a totally different way now, but they breathe into these bags, and at baseline before the fiber is consumed, and then 30 minutes, 45, 60, 75, 90 minutes later, and then the bags are sent to the lab, and then the lab quantifies the degree to which there's hydrogen gas in these bags. And if there's hydrogen, certainly prior to 60 minutes, that's too short of time to reach the colon. So we know that there are fermenting bacteria in an excessive amount in the small intestine. And so that's how that's diagnosed, and that would indicate SIBO. What I use now is something called the AIR device from a company called Food Marble. I don't have any relationship with them, but it's a cool device. It's a handheld little device, like maybe half the size of your cell phone, and it communicates with their app. And it's a breath analyzer, and it's detecting gases, hydrogen and methane gas, and then it quantifies it into a very simple readout on their app, and then it lets you know if there's too much hydrogen relative to the timing after the fiber challenge. So that's what I use now. What's nice about that is we don't have to get a lab kit every time we want to retest. That the patient purchases this Air device once and they get to use it over and over again. So it's pretty cool. And then from a treatment standpoint, obviously number one is we have to knock out the bacteria that's in the wrong place. So there are pharmaceutical antibiotics for that. But in my opinion, that's part of the reason why we got into this mess, because it's oftentimes antibiotic use that throws off the balance of the good guys and bad guys in the gut and allow those bacteria to transmigrate, ascend, and expand their real estate into the small intestine. So I go more with herbal antibiotics to treat the SIBO, the bacteria in the wrong place. And then we do things like that's sort of getting rid of the bad guys, but then we want to promote the good guys. So after maybe a month, maybe 6 weeks of the herbal antibiotics, then we want to start to reseed and introduce a bunch of the good guys with fermented food, specific types of probiotics, different, fermented food and so forth. Things like good quality kimchi and sauerkraut and even pickles and certain types of yogurts. A lot of yogurts on the market are just like dessert. They're absolute junk. We also have to think about diet. We really want to get out of the diet the things that feed the bad guys in the wrong place, which is pretty much sugar and processed food, like processed grain-based foods. So it's pretty much a grain-free, sugar-free diet that we have to follow during a SIBO protocol. So it's pretty intensive, which is why I really want to diagnose before we treat. That's the key thing. And then once all that process is initiated, then we want to fertilize the good guys in the right place. So we use certain foods that are rich in these prebiotic fibers. So prebiotics feed the probiotics, the good guys, and then the probiotics produce the postbiotics, which is like the short-chain fatty acids. And then hopefully all this is now happening in the small intestine. But then we can test as we go to make sure that we got it right. So we could talk for 3 hours about SIBO. It's a complicated but really important condition. But that's just the quick download on that. So if you have symptoms associated with that, then I would really seek out getting appropriate diagnosis and treatment, because it can be a real issue and it could throw off the function and health of your gastrointestinal tract. So hopefully that's helpful. I will speak with you soon. We will come up with another topic. Certainly if you have any topic suggestions, shout out, because I will discuss them on the show. So until then, keep it real.